Did you know that you can impact your libido, bladder control, and vaginal moisture with intentional movement? Did you know our brains listen to our joints more closely than other tissues? Well, neither did I until I met our guest today. We're going to talk about how vaginal atrophy is out and how more supportive and encompassing language about our bodies is in. We're going to talk about how joint strength is the new buzz in fitness and how we can support this transformative time with mindset, motivation, and management techniques. So, whether you're using HRT or navigating the wave without hormone replacement, you're going to want to listen in to the Menowave Lounge, hot flashes, and cool conversations. Welcome to the Menowave Lounge, hot flashes and cool conversations. I'm Marti Daly, and my co-host Robin Duke is out today. I'm excited to introduce our guest, Terri Lynn Heath. Terri Lynn is a strength, mobility, and lifestyle coach for women in menopause. Her mission is to empower women to understand the incredible control they have over their health and their menopause experience through movement and self-care. Terri Lynn has been in the fitness industry for 20 plus years and came to menopause coaching through her fascination with joint strength. We're here with her today to talk about our pelvis, our joints, and what we have the power to control as we face the risks associated with menopause. Terri Lynn, so much welcome to the Menowave Lounge. I'm so happy to have you here.
Thank you, Marti. It's a pleasure to be here. I'm so excited to chat with you today.
Me too. This is going to be a really good episode because I know from being in the menopause support group, a lot of women are struggling with some of these topics that we're going to talk about. So I'm really happy to dive in. But before we do, we always like to start the show with just what we call a Meno moment. So this is just a fun little lighthearted something that comes out of the blue and grips us in menopause. Actually, I'll have you start us off. What is your Meno moment?
Oh, my Menno moment is a reoccurring one. And my 13-year-old daughter will frequently say to me, Mom, you told me that twice already this week. I'm like, no, 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 no. And I make her go back and tell me where I said it, when I said it. And it's a little bit disturbing, but we have fun with it.
I can totally relate to that. I remember my mother used to do that. And probably about your daughter's age, I used to get on her and say, you told me that already. You told me that already. And
Mhm.
as I was telling you a minute ago, I'm hearing it too now. They're telling me, yeah, Mom, you already said that. And I'm like, no, I didn't. And then here's the thing that I'm going to add on with my mental moment is that not only are they saying, Mom, you told me that already, it doesn't matter what I'm saying to them. They're like, okay, Mom, like calm down. Like, okay, you don't need to freak out about it. You don't need to be panic mode all the time. I'm like, I am not panic mode. I just want to know where is the whatever I'm looking for. And they're like, okay, Ma, calm down. I was like, really? Because I always feel like I'm this calm, cool, collected person, but I guess to my kids, I'm
Mhm.
not always that way. So it's just kind of fun, something to laugh about. I would say I feel bad because I was really hard on my mom when she was going
Oh,
through it.
yeah, me too.
Our notice now, okay, payback is fun.
Absolutely.
Well, good. I'm excited to have you here today. Let's start out, Terri Lynn. Why don't you tell us a little bit about your story, your background? How did you become involved and interested in women's joint strength and health and mobility, especially women in menopause?
Great. Thanks, Marti. Yeah, I'll go way back to paint the picture here. I lost my parents when they were 60 and 61 to cancer. And following that, I became really interested in how I was going to stay here longer. Then, in addition to that, three of my grandparents also died in their 60s.
Wow.
So that's a lot of odds to beat. And since I struggled to become pregnant and had a really hard time having or becoming pregnant with my daughter, my one and only daughter, she's 13 now, I'm absolutely dedicated to being here for as long as I can. So when I had the opportunity to kind of redefine my career, I left corporate in 2022. I had always been in fitness, teaching classes for a very long time, as you mentioned, plus 20 plus years. And I took a good look at what I wanted the second half of my life to be like. And I had injured my knee in 2019 and been already working on rehabilitation after being very, very rubbery all my life. I would always say, like, I must be rubber or superhuman or something because I can roll my ankle and I bounced right back. I never have had any injuries prior to that. But when a dog hit me on the beach, took me out like I was in a football game
Wow.
and tore my MCL and my PCL, it was a major setback for me. So coming back from that, I began to understand how our bodies work and how our bodies heal and what we can do to impact our health through movement. So I came back from that and I became acquainted with joint strength work, and shortly after that became certified in joint strength work through functional range conditioning. And what I learned there blew my mind and definitely has changed my body and my relationship to my body. So as I was learning more about that and redefining my career path for the second half of my life, I decided that since I was on this health journey, I was going to have a career in health because I was already so interested in it, and I'm dedicated to being here for as long as possible, learning all these really fascinating things and wanting to bring that to people and help people understand the impact they can have on their health. And meanwhile, I'm going through menopause as well, or during that time, I was experiencing perimenopausal symptoms and not even realizing that it was perimenopause until 48, fast forward to 48, and all of a sudden I'm postmenopausal, looking back going, oh, that's what it was. That's what the migraines were. That's
Yeah.
what the sleepless nights and the anxiety was all about. And only then did I start to put together the connection between my troubles with having my daughter and my menopause age. Because when I entered into my fertility journey at 34, I was told that I had the egg supply of a postmenopausal woman.
Wow.
Didn't understand at that time. It didn't matter to me what that meant. I just wanted a fix, I wanted to have a baby. So I worked with a naturopath and fertility specialist, and luckily one shot with IVF, and my daughter is with us. So
Wow. That's
amazing.
I've known women that have done many, many rounds. Thank you for sharing your story. I wanted to go back, and you had mentioned something interesting. I heard you say when you were going through your training, you learned something that really blew your mind. What was that big takeaway?
Yeah, the big takeaway for me with joint strength and what I learned was that the information coming from our joints is prioritized by the brain and bypasses the filtration and the triage of the spinal column that all the other movements from our body go through. And it's prioritized by the brain, moving straight from the joints directly to the brain. And that shows us that the information coming from those joints is of the utmost importance to our health and our movement. The work I like to do more than anything is that preventative work. So we can
Right.
strengthen our joints by moving them through their full range of motion regularly, and also altering the angle of the joint as we move through motion to then encourage strength.
So as we're coming in through menopause, are there certain changes that we need to be aware of as far as our joints go? Like you found no
Mhm.
longer having the rubber, the rubber
Definitely.
body, but what are some things that we need to be aware of?
So our tissues thin, as we know, because we have those estrogen receptors all over our body. And one of the risks of menopause is that our joint tissues thin, along with other tissues throughout our body. So we definitely want to stay ahead of that.
Mhm.
And just like we'd want to stay ahead of osteoporosis or the loss of muscle mass, and we can stay ahead of that, but through regular intentional movement. And a lot of people don't understand or don't really have the education that we can actually lay down new tendons and new ligaments.
Mm.
And many people think that connective tissue just thins with age and there's nothing we can do other than take supplements. And that isn't true. We can think of our muscles and our joints and all the connective tissue like a web fabric, not layers, but more interconnected. So everything impacts the other. So yes, muscle strength works, strength training absolutely does affect our joints, but we can also do joint strength work specifically that also impacts the muscle and that connection. And that's so important. And that is the new buzz in fitness. You might hear it and see it on your social media feeds where people are talking a lot about mobility.
Yeah.
And mobility should be referring to the strength that you can strengthen your joints.
Well, and that's very important. Mobility is near and dear to my heart. A few years ago, I was having lower back issues. But what really stuck in my mind was just how much I had been taking my mobility for granted, my ability to even, clean up the kitchen or shop through Costco. I had to like sit. It was just so much pain. And I was sitting there thinking, my gosh, at the time I was like 48 and thinking, I am way too young to not be able to walk across the store. Like, this is unacceptable to me. It was an eye-opening moment of like, the longer I sit on this, literally sit on this, it's not going to get better. It's just going to keep getting worse and worse and worse. And so I was able to thankfully get the help that I needed and the treatment that I needed, and I'm fine now. But the message I got going forward is not wait on this. Like, when I start noticing something's wrong, I need to deal with it. Going back to intentional movement, I heard you say that earlier. What is intentional movement?
Intentional movement refers to taking your joints through their full range of motion, slowly in a controlled manner. Or when we talk about the pelvis, for instance, we would be taking our hips through their full range of motion because it's so important to benefit the mobility of the hips because it's so crucial to our well-being and our ability to stay mobile, like you were describing. You've heard the term move it or lose it, or you don't move where you don't move. And that is so true. And it does refer to the information that's coming from our joints is essential to maintain the health of. So there's nothing in the brain that says maintain the health of the shoulder. It's literally the movement coming from the shoulder that tells the brain it wants to move. Our bodies are incredibly efficient and our brains don't spend energy where it's not needed. So for instance, if you're sitting at your desk for 8 hours, it's going to spend energy there. And that's what it will help you do. But if you're moving your joints through their full range of motion, moving intentionally in ways that you know are efficient and can help build those building blocks of movement and mobility, then the brain will spend energy there. And new neural pathways are created, which is very great for women throughout our lives, but especially women in menopause, as we know that our brains change and it's important to continue learning things. So that movement coming from the joints is new information for the brain, and thus new neural pathways are created. And that has a lot of benefit as well.
So I wonder if a lot of women take for granted what they used to do. And is there a certain point where, like you say, you move it or lose it? I could start telling just the fact that I would get more tired just doing the simple little things. How long does it take for our joints and our body to start forgetting or start, what's the word I'm looking for? Not deteriorating, maybe deteriorating. And how simple is it to get back on track? Is it like maybe there's some movement exercises to build into our routine just to keep us going?
Yeah, definitely. Great questions. Well, the strength of our joints, just like our muscles, will start to decline at age 25 unless we're regularly building and exercising and moving as prescribed by the health and fitness industry. In a study that was done recently on strength training and building muscle, we understand that no matter your age, you can gain strength at the same rate in a 10-week period. So that's the good news.
Yeah, yeah.
It's not necessarily our age that restricts us from health and becoming fit. It's the actual movement and the buy-in, the willingness, the intentionality of deciding that you are going to embark on an exercise and fitness program. If you don't have, injuries, if you're healthy and mobile and can move. And I like to say setback psychology is really important to think about in any kind of exercise program because, like I mentioned, when I injured my knee, it was a hard emotional experience to go through because I was a dancer and I was, active all my life, and I prioritized my health. And all of a sudden, I had to wear a straight leg brace on crutches for 6 months. And so that was really hard for me. But I also have 59 other joints in my body, depending on what expert you talk to. I understood that I needed to continue moving those joints and continue to strengthen the rest of my body, because that setback is awful and discouraging, but I have all of these other body parts that also need to be taken care of. So I guess the answer is we can heal, and we can heal throughout our lives, and we can impact our muscles and our ligaments and our joints throughout our lives. And this really is a lifelong journey. We have, move it or lose it is, happens throughout our lives. And if we stay active, we have a better chance at maintaining our health span. And really, in my work, whether you're on HRT or not, we're all so different in our experience of menopause. We're all unique, and every one of us has a different experience. And I do not discourage nor promote any supplement regime, hormone replacement therapy. Everyone has the right and their responsibility to choose well for themselves. But exercise is a non-negotiable.
Thank you for that. And I feel like it's encouraging for women to hear. So I know it's for me, no matter where you are, injury notwithstanding, but even if you have, like a lot of us, I think, do kind of get into a more sedentary lifestyle. But it's good to know that we can get back out. And as long as we put our mind to it and put some energy behind it, we can get back to a place of healthier movement. For someone maybe who is just now starting to get back up and paying attention to our mobility, are there anything that they can do, or do they need to immediately like get into a professional program, or is there like some movements that they could go through just very simply just to get them started?
Yeah, definitely. Great question. I love spinal segmentation as a great place for all of us to start. You're probably familiar with the cat-cow in yoga,
Yeah.
or in other programs. Likely, I'm familiar with it from dance. It's a common warm-up. But spinal segmentation asks your spine and your vertebrae to try to move one vertebrae at a time independently of one another. And it's challenging, but it's that slow and intentional movement that engages your core, that engages your pelvis, that engages your cervical spine. And it's lovely and is really accessible to most people as a nice place to start. So you just get on all fours, start at the base of your pelvis, and attempt to move your spine into flexion or arching up towards the ceiling.
Yeah.
And then from your pelvis again, initiating movement and starting to drop your spine into extension or into cow. And it's wonderful for your nervous system. It definitely calms you really quickly, and it helps your brain again, creating those new neural pathways
Yeah.
that are so important for our brains and our bodies. And then there are the controlled articular rotations for all of our joints. And that's where I start all of my clients that I work with, no matter their level of fitness.
Yeah.
We start there with that basic mobility. And then depending on their fitness level and their interests, and we build upon that either quickly or slowly.
That's good to know. I did those cat cow stretch. I did those in physical therapy with my back. I'm
Oh,
like, oh, yeah, I
nice.
remember that. Yeah,
Yeah.
highly recommend them. Thank you for sharing.
Yeah, for sure. And they can alleviate lower back pain, upper back pain pretty quickly as well.
And start building those new neural pathways. I work with creating new neural pathways on the emotional side, on the subconscious, and it's really cool to hear that, yeah, it works the same with actual physical movement as well. So that's awesome. When we talk about our tissues thinning in menopause, our joints aren't the only place that our tissues are thinning. We get a lot of thinning in our vagina, our pelvic area. Do you want to share with us a little bit about what women might encounter as we go through this time with our thinning tissues?
Yes, definitely. Thanks for raising this question. This is something I'm so passionate about and something I'm focusing on a lot currently. So we can experience the thinning of our tissues in our vagina, in our urethra, in our bladder, and throughout our pelvis. And this is referred to as genitourinary syndrome of menopause. And it really describes a progressive condition that can start even before menopause. And 19% of premenopausal women actually experience this. And I can talk about some other risk factors, but menopause is definitely a risk factor. And I'm really passionate about this currently because you might have heard the term vaginal atrophy. And that is the medical diagnosis of genitourinary syndrome of menopause. And it's unfortunate and it's demeaning and shameful and it has all those negative connotations.
Because you think of like, we think of something atrophied, it's
Yeah.
like dried up and dead.
Mhm.
It's such a sad and heartbreaking way to think of a very important part of our bodies, a very beautiful part of our bodies.
Definitely.
And going through these changes, a lot of women, and I'm guilty of it as well, we start thinking down on ourselves. And, you know, then you get a term like, okay, well, like I'm dry, dusty, dried up,
Mhm.
atrophy, you know,
Yeah.
it makes you almost even want to contract and shrink in and just hide, not do anything about it, but just accept it. So it's a
Definitely.
very good point that you make about even the terminology.
Yeah, and it's inaccurate and it's not fair. And it's
Yeah.
just another thing we women have to deal with. And I say it's inaccurate because it doesn't take into account all the other things that are happening and are at risk. It whittles it down to just the vagina. And in reality, the bladder is affected, the urethra is affected, and all those, and by just focusing on the vagina and making us feel bad about this inaccurate term and
Yeah.
this inaccurate action, we we're not able to take care of the rest of the things that are happening because we're not told about it, about the condition itself. So
What kind of goes along with that? So you mentioned the bladder and the urethra. Would that show up as like UTIs, or
Mhm.
what else would that
Yes,
show up as?
pain. Yeah, it could show up as pain. It can show up as incontinence. It can show up as UTIs, prolapse,
Mm,
where you might be familiar with prolapse,
yeah.
or where the organs begin to fall through the pelvic floor muscles dropping, a bulge in the vagina. All of these things are classified as vaginal atrophy, but there's this whole slew of things that are going on functionally that we have to treat and that we have the right to know about in order to treat it accurately and gather the team of professionals that we deserve to care for us. So that would involve a gynecologist, a pelvic floor therapist, and a coach like me who would help you implement movement regularly. So the good news is you can impact GSM, or genitourinary syndrome of menopause, with pelvic floor strengthening. It's one of the treatments that has been shown to work and to directly affect vaginal atrophy or GSM.
I think a lot of those things you don't really think about until you start noticing symptoms. I had no idea that could be a part of the thinning of the tissues. I just thought I was like, well, I must have done something wrong along the way or abused my pelvis somehow, either with, weight or childbirth. That can be contributing factors, but it's helpful to hear that this also is a partly of a hormonal thing. Do you mind sharing with a little bit about what pelvic floor therapy is?
Good question. So, pelvic floor therapy involves movement and exercises for the pelvic floor. And I always start in my practice with the connection breath. So, our pelvis and our pelvic floor and our diaphragm and our entire core are always responding to intra-abdominal pressure. And that's always responding to breathing, just normal breathing without even trying. Your pelvic floor and your diaphragm are moving towards one another regularly and away from each other regularly with breath, as is the sides of your core. So if you think of it like a sparkling water can, you just like the pelvic floor is the bottom and the diaphragm's the top, and the are your core muscles, your rib cage, your abdominal muscles. And so the first thing that I implement in pelvic floor therapy is the connection breath. And that's basically overloading the pelvic floor with breath. So asking the pelvic floor to relax and move away from the rest of the core and move back and contract a little bit more than it would normally. So we apply the same principles of muscular training to pelvic floor health, to pelvic floor muscles. There's 3 layers of the pelvic floor, and we need 3. We know, because of childbearing, all that weight bearing down on the pelvic floor. And the pelvic floor sits like a hammock within the pelvic girdle, creator attached with connective tissue. And it bears a lot. It has a lot to do. It holds all the organs. And then, like you said, when you're pregnant, it also has to do that. And that's why we see incontinence or leaky bladder very common. And we just need to talk about it a little bit more, because 80% of women experience that at some point in their lives. And again, our tissues are thinning as we get older. So in order to stay ahead of the game, we can implement pelvic contractions. And a lot of people are familiar with Kegels. The connection breath is a little bit more of a slow contraction. We're asking the pelvic floor to really contract slowly like an elevator and relax slowly.
Is it a breathing technique? Does it like require special equipment or putting your hands a certain place? Or is it more when you take in that breath, imagining where that goes?
It's a breathing technique, and I like to place and ask my clients to place their hands on their belly. And when you inhale, you fill your whole diaphragm up with breath and ask everything to relax on the inhale. And on the exhale, you're accessing or getting in touch with your pelvic floor and pulling it up towards your belly button like an elevator on the exhale. And
Okay.
again, slow, not fast, but it might be fast at first, because as we connect with our pelvic floor, we might not feel it right away. So it might be a quick contraction. So nothing's wrong here in terms of becoming aware of your pelvic floor. We're just trying to feel it. So on that exhale, we're bringing the pelvic floor up, contracting it, giving it a little squeeze, almost like you can imagine that you're trying to pull a tissue out of a tissue box with your vagina.
That is fascinating.
Totally. So that is my favorite secret of all time. You can do that everywhere, anywhere, laying down, sitting there, in your car. And then once you get used to it, you can pair it with exercises. And there are definitely more exercises for the pelvis, the pelvic floor specifically, that I teach, and including hip mobility and different things that place pressure basically on the pelvic floor and ask it to contract and release, contract and release. It is also recommended in any strength training program for women in menopause that you're pairing the connection breath with a bicep curl. So on the inhale, your arm is straightened. On the exhale, you're contracting your bicep. You're also contracting the pelvic floor. So that's a way that you can continue to train your pelvic floor on all of your programming.
Oh, that is good.
Yeah.
Now, with the thinning tissues in the pelvic floor, is painful intercourse a part of it too? Does pelvic floor therapy help with that, or is that something that does require HRT?
Pelvic floor therapy does help. It has been shown to help. And sometimes HRT helps too. So it definitely depends on the individual. But absolutely, trying pelvic floor therapy is an easy, safe thing to try first for us all. And if you have a question, definitely it's recommended to connect with a pelvic floor physiotherapist if you have symptoms of prolapse, if you have symptoms of pain, if you have any vaginal or bulges in your vagina, or definitely any pain or discomfort that is affecting your quality of life, getting in touch with a pelvic floor physiotherapist is always recommended. And I say pelvic floor physiotherapist, and that's really a physical therapist in the United States, but physiotherapist in the rest of the world. And it's important that they do specialize in pelvic floor health.
Right.
Because a physical therapist knows the entire body, but what you really do want for women who are experiencing symptoms is for someone who specializes in the pelvis.
Good to know. Good to know. Something I'd seen some women talk about in the group is, like we said, use it or lose it. And I know that what I've seen with women when they are starting to notice pain and discomfort when they are having sex, other people say, well, you just got to keep doing it and it's not going to be as bad. Is that wrong?
Yeah, we don't want anyone to be in pain.
Yeah.
Pain
Yeah.
is a sign that we need support. I should say other treatments of genitourinary syndrome of menopause can be hormone therapy, can be vaginal lubricants that have hormones, and some are non-hormonal. Working with that team of a gynecologist, a pelvic health specialist, or physiotherapist is always a good idea to make sure that you're not suffering through pain, especially none of us should be.
Right. It's knowing that those treatments are available and that those professionals are available. And this isn't something that we just lump or we just take it, right? Because we're just supposed to. I think it's very important to share that there are things that we can do. There is help out there. And
Mhm.
it's not just taking a supplement or taking HRT, but there's exercises and it so many different avenues to help ourselves through this. I'd like to move on into your approach to optimizing menopause and four pillars you would talk about. Do you mind sharing what that is and what that looks like?
Yeah, definitely. I use four pillars of mobility, mindset, motivation, and management. And mobility, we've kind of talked about, we have to build that foundation of movement. We can think of our bodies kind of like a house where we have our beams overhead and our beams on the side and beams underneath, and they're all connected with joints. And we need those joints to be strong, or otherwise our house falls down on us. So that's always the foundation for healthy movement, is making sure that our joints are stable, and then we build programming accordingly on top of that.
May I
And
ask on the mobility? Let's say someone is already active, like they go and they do the treadmill, and then maybe they do some strength training because they've been listening and they know that that's important. Are they good, or are there areas at this stage that they may be doing all the things, but they really ought to pay particular health, not health, pay particular attention to?
yes. Well, I always start with joint health, whether you're active or not, and then move pretty quickly to incorporate further training to support what you're already doing and what you love to do, because that's really important. If you're in a program that you enjoy, that's one of the most important things,
Right.
because this is a lifetime relationship with movement we're talking about, not just a 12-week program or anything like that. We're setting the stage for you to move throughout your life. What's important about joint training, we can think about the concept of injury is that, and this applies to whether you're hit by a bus or whether you're rolling your ankle in the garden. If the strength of the impact is greater than the internal strength of your joint, you will succumb to injury.
Mm,
Injury happens when the internal strength does not match the external force.
okay.
So we can be strong, our muscles can be strong. We're in a strength training program. Awesome. I'll never tell you not to move, to
Yeah,
stop doing
exactly.
what you love to do. And strength training, yes, for everyone. But we do have to make sure we're also building those joints at the very foundational level. I've talked a lot about joints, but rotations, those articular rotations I talked about, actually build space within the joint.
Mm,
And that's good space that is lubricated by synovial fluid. That synovial fluid is excreted when we apply pressure to the joint. And that creates that space that also serves as the foundation for more ligaments, more tendons, more connective tissue to grow, and brings nourishment to the joint. One of my instructors said that controlled articular rotations are like brushing the teeth of the joints.
mm,
Literally, they should be done every day. And
okay.
I do a head to toe controlled articular rotations daily, and they're fast. I can do them in 8 minutes while I'm waiting for my coffee to brew.
I got the image when you were sharing that of the Tin Man from The Wizard of Oz.
Yeah.
Are there any joints that, as we're going to menopause, even if we are active, that we need to be particularly aware of?
Well, we know that a frozen shoulder
Yeah.
is a common symptom that happens for women in menopause, and they seem to come on pretty quickly and go away pretty quickly. And during a frozen shoulder event, you should definitely be seeing someone in person who can help you work through that, a joint specialist. What we can do to prevent that, again, are those articular rotations, taking your joints through their full range of motion. If you're only moving your shoulder behind you to get your purse out of the back seat, once
Yeah.
a week or something, and that's all you're doing, your brain doesn't really know you want to do that more often. And if it's just this and not this
Yeah.
all the way around in a controlled fashion where it's allowed to build those neural pathways, then we may experience injury sooner or later in that shoulder.
Yeah.
Baseball players even don't get trained. Pitchers don't even get oftentimes trained for that full range of motion and
Right.
that strength within that, and then they tear their shoulder. So the strongest weightlifters, we see it all the time, people trying to lift too much, not taking care of the foundation and deep inside that would help prevent something like that.
That is so important. And so then moving to pillar two, which is mindset, and which is also near and dear to my heart. I know it's near and dear to Robin's heart. What are some of the limiting beliefs that come into play with the women that you work with?
Definitely. Good question. I spend a lot of time on limiting beliefs as we work in the mindset pillar because they do follow us throughout our lives and affect the way that we move, affect our relationships to our bodies, affect the love we have for ourselves, if, sometimes preventing us from fully accepting ourselves and loving ourselves. So a limiting belief that I see is I'm not a runner. Runners are tall and thin, and I'm not that way. So I've never figured I should be a runner. Or oftentimes their parents didn't model activity. They didn't ever engage in activity at a young age. I do an exercise that helps to look at all the different periods throughout your life, how you felt about your body during that time, what activities you were engaged in, and basically examining your movement path throughout your life and trying to identify any beliefs that may be holding you back from moving now or moving today. Like what's going on there that prevents you from exercising today? We all know we're supposed to exercise. So why
Right.
why aren't we? So like really digging into what's holding you back from caring for yourself and from falling in love with yourself.
I'm glad that you brought that up because I think we overlook that. I see that with my clients. We work with habit changing a lot, right? Which goes with the beliefs about how is this serving you to do it differently, what shifts can we make? But I would have people come to me thinking, well, I want to be motivated to exercise. I know I need to move my body for health, but I
Mhm.
hate it. I don't like the way it feels, all this stuff. I mean, they would almost get combative. They know that they need to move. And
Mhm.
there's something up here that's almost beyond like, oh, I don't like the discomfort of when I first start out. And yeah, it's definitely worth looking at it like, well, where did that belief come from? Is it true? Is it always true? What else could be true on
Mhm.
those paths? We get what we believe, right? So if you have
Mhm.
someone, like you said, who their family was like, well, all of us are lazy. No, nobody runs. Oh, you're not a runner. Oh, you're not an athlete. You're not this, you're not that. You hear that, and it could not just be around exercise, but oh, you're not the smart one. You're the pretty one. Your sister's a smart one, and vice versa. Or no one in our family ever made money, that kind of thing. When we hear that our whole life and we have that demonstrated for us, that belief is so strong
Mhm.
as far as who we are that it's not as simple as like going, well, okay, I need to do this. You have to fight decades of belief and programming. And the good news is that it's not difficult to shift that. And if you can't do it on your own, I mean, there's certainly tools to help and there are people that can help. That's actually what I do. That is important. And it does show up because we get what we believe. We're a big fan of affirmations, as I am. You have a favorite affirmation. What
Mhm.
is it?
Yeah, my favorite affirmation is realize your efforts.
Beautiful?
Notice your efforts, realize your efforts. And that really helps ground me and my clients, really celebrating the path along the way to the goal and helping us acknowledge ourselves for trying and for putting the effort in, whether or not we've lost the 5 pounds or gotten the 160 grams of protein that we're supposed to get a day.
Oh,
Compassion is so important to have for ourselves and for others because we have to be our best friend. We're the experts on us. We are the managers of us. We have to take care of ourselves and advocate for ourselves and become the champions of self-care. So we have to love on ourselves. We have, and that realize your efforts just helps us to do that. It's not about the goal.
right.
great when you like, please celebrate yourself when you get there, but also celebrate yourself along the way daily.
You're absolutely right. And I like Coach was talking about that because we're just so hard on ourselves. I mean, the world comes at us enough.
Yeah.
And we just pile on and add to that. And like you said, celebrate along the way, celebrate the effort, celebrate where you are, because you keep doing that day after day after day after day, you will get to your goal and then you'll get to your next goal. But if we sit there each time and be like, well, I'm day 2 and I still have 100 pounds ahead of me that I need to let go of, but I'm not there yet. Well, yeah, I did everything I was supposed to do today, but I'm not there yet. I'm not there yet. I
Right.
mean, even just hearing that, it's so
Yeah.
deflating and it's so defeating. And one of the things that I always emphasize with my clients is celebrate your successes, celebrate your victories, celebrate that moment,
Hmm.
regardless of what's come next or falling off, what have you. Celebrate that have you. I used to do that for myself. I would, back when I was on the treadmill, I never really cared for jogging, but I would do it. I don't do it now just because there's other things that are better for me. But back when I used to jog on the treadmill, I would tell myself, I'm a powerhouse.
Yeah.
I'm not going very far, but I'm like, yeah, I'm a powerhouse. I got up here on the treadmill today and I did it and I'm done and I'm sweaty and I can't breathe and I'm not fast at
Mhm.
all. A little old lady next to me is going faster. Goodness, I did it. What I will add on to when we're talking affirmations, and an affirmation is a short positive statement in the present tense.
Mhm.
Feel it when you say it, when you share it, when you think it or you say it to yourself. Take a moment, close your eyes, put your hand on your heart.
Mhm. Yeah.
Feel it in.
Mhm.
What do I feel like? Where do I actually connect in my body for
Mhm.
this to be true? And it just makes those affirmations so much more powerful. I love that.
Yeah.
Moving on to speaking into that with motivation, because if we're constantly trying to get to that goal and we're not celebrating where we are and honoring where we are, what else comes up for with motivation that you're seeing?
I mentioned setback
Yes.
psychology. I'm fascinated by setback psychology and how do we move through in the face of setbacks. I have a lot of workshopping in my programs regarding setback psychology. We can't manage what we don't understand. Education is a strong tenet of motivation. So understanding that what we're capable of, what our bodies are capable of, and what's actually happening is really important. And that helps to drive people forward and stay motivated, understanding that they have all these other joints that still have to continue working, all these other muscles. There's 600 plus muscles in the human body. So understanding that those need attention too helps us to stay motivated or to find our motivation. Understanding the difference between behavior goals and outcome goals. A behavior goal is something we can control. Like, I'm going to drink 60 ounces of water today versus an outcome goal of I want to fit into my pants from high school in 3 weeks' time. Right. So it's a smart goal, which is specific and measurable, but it's not necessarily attainable within our control. We can't control that, but we can control how much we eat today, what we put into our bodies, how much water we drink, how much movement we do. We do need to have outcome goals as well. Though it's not that they're bad, they're the bigger goals, they're the bigger priorities. And then we have behavior goals that help us get there.
Yeah, and I love that point you made on that because when I think of a behavior goal, that feels like that actually lights me up because it's like, okay, well, I can do that. I can get X amount of water. I can get X amount of protein. I can get this if I just focus on that. And if that goal is at the end of the day, I've done these things, then great, I have done that. Whereas the outcome goal, yeah, that's what I want that to be. But I can almost look at it as, well, that's like the gold medal. It's like the payoff for paying attention to my behavior goals, which are within my control. And so I feel like I'm guilty of this. We lose sight of the behavior goals and we're so focused on that outcome goal. We really, it would be better off to focus on, hey, these behavior goals
Mhm.
that even if that the goal never happens, my goodness, we're going to be so much better off, so much healthier, and we can rest easy at night knowing that we're doing everything within our control to get us there.
Yeah, we have so many decisions that we make on a daily basis that are entirely within our control.
Yeah.
And it's nice to notice those. Like, I'm going to choose to move from here to the sink and grab some water instead of going to the pantry where I want to grab chips. We make tiny little decisions daily that impact and build up to bigger ones.
And on that too is that if those are the kinds of things that we're struggling with, when I walk past the pantry, the cookies are screaming my name and I can't get past that. Well, those are things that we can look at. Those are things that even if it's a struggle for you, there are tools, there are techniques, there are people that can help you manage that and help you through that, which makes the outcome goal more attainable. That leads us to the fourth pillar, which is management. How does that fit in?
Management refers to how are we going to manage our movement path forward? How are we going to support these new habits that we've developed? Now that we've embarked on this self-discovery, what are we going to do with that? How are we going to honor that? How are we going to take that forward and carry it forward? So management involves self-care techniques like lymphatic drainage, which I'm really passionate about.
What is lymphatic drainage for those that don't
So
know?
lymphatic drainage is draining the cellular waste through our lymph system. So our lymph system is continuously purging our cellular waste, the cells that die that aren't needed anymore. And it's important that that lymph system is functioning and clear and flow. When women experience swelling, joint swelling, sometimes an underlying cause of that is that lymph system is a little stagnant. Maybe they're not drinking enough water, maybe they're not exercising. All of those things impact the flow of the lymph. And the lymph are in our joints. So another reason to move your joints through the range of motion. So lymphatic drainage, you can do it manually. So you might have heard of lymphatic drainage massages. You can also go to a treatment center who specializes in lymphatic drainage and have a lymphatic drainage massage. I personally do a combination of dry brushing and movement with my hands on my body in different ways. And so that just, it optimizes the system and continues to encourage the proper flow of lymph.
What are some other components of management?
So things like meditation, continuing to incorporate affirmations, meditation. We've looked through any programming with me. We've looked at the history of your movement path, how you're moving now, how you want to move into the future. So really leaving any program or sending you off with this plan that of movement that can take you into your future.
Thank you so much for sharing all of this. I have learned so much. Now, you mentioned the movement path and these four pillars. They're part of your programs. Do you mind sharing with us what programs you offer and how we can get in touch with you if someone wants to chat with you and work with you further?
Thank you. Yes. So I offer a 12-week program called Optimize Your Pause, and that is for women in all different stages of menopause. So whether you're in perimenopause, menopause, or postmenopause, it's a group program. So group coaching weekly, one-on-one coaching weekly, and modules over that are designed to kind of take you through your journey over 12 weeks time or 6 months time. It can be extended too, which is I'm finding is nice for people who just want to take a little more time with it. And it's hard to do something in 12 weeks and show up every week. So we can extend that to over 6 months time. There's a big focus on menopause education throughout the whole 12 weeks, pelvic health modules, menopause and sex, how to track your nutrition, how to track your symptoms, all of that with group coaching, one-on-one coaching designed to help you meet your individual goals, depending upon you and where you are in your journey and what specific goals you have. We work together to get there. And then in addition to all of that, a fitness program that is tailored to you and to your fitness level and for your fitness goals and your lifestyle circumstances, along with behavior change, counseling, and habit formation, and all that good stuff. So
Now, is this online?
it is. All the modules are on a digital platform. My website is themovementpath.com. I have my calendar link there as well. So you can always book a call, 30 minutes on me, complimentary, to learn about you, to learn if we should work together, can work together, or if I can refer you to another specialist who can help you and meet your needs.
Wonderful, wonderful. Thank you so much, Terri Lynn. This has just been amazing. I've learned so much more. Like I say every time I do one of these, is that I just learned so much that I didn't realize before, and has me looking at my own health and my own habits. Anything else that you want to share to our audience that maybe I haven't asked yet or we haven't covered?
I really believe that we have tremendous power over our health, and it's through education and through engaging with our bodies and with the support that's all around us, and reaching out to our community and the menopause group and support group and our other friends and family. There is support out there, and reiterating another point that we should never live in pain if we can help it at all. There are resources and support available to you. And by understanding that power we have over our health through movement and all that support that's available to us, we can reclaim ourselves, reclaim our agency, and move through this transition, this totally normal, natural transition. With all the symptoms piled on, we can move through it and gain control and power and be the boss of ourselves and love ourselves.
Absolutely.
Mhm.
Absolutely. Yes. And love ourselves. And like Terri Lynn said, and like we've been saying, is if you're struggling with anything, any of this, there's no need to suffer alone or be in pain or to have distressing thoughts. There are so many women here in the menopause support group, the Menowave care providers. We're going through this together. We all have our various areas of expertise that we've studied for, we've experienced, that we can bring and help. And kind of going along with what Terri Lynn said with creating new neural pathways as far as how our bodies move, we create neural pathways as well as how we respond emotionally to what's going on around us. And this time of change with our fluctuating hormones, our bodies are changing, our subconscious minds are registering that change.
Mhm.
And sometimes our subconscious minds are like, something really is terribly going wrong. And we start feeling symptoms of stress and feelings of anxiousness or fear that we don't understand where it comes from. And at the same time, we are also learning that how well we've managed our trauma, our stress, beliefs we've had about ourselves, menopause as women, all of that stuff piling on for the decades, showing up right now too, and having an impact on how our body is working. So our mind and our body are connected. If you are struggling on the emotional side of that, reach out to me, reach out to one of the coaches. My tool that I use is hypnosis, and my program is about retraining the mind, recreating new neural pathways to better process the fear, to gain back our confidence, to bring peace and calm back into our lives, getting out of that stress, panic, and overwhelm. So if you want to learn more about that, you can go to my website, which is martidaly.com. martidaly.com. There is a no cost 45-minute webinar that really takes you through where I come from and how this fits together and what you can do about it. And at the end of that, I give an offer for you to jump on a no cost 45-minute consultation with me, much like what Terri Lynn said. Find out where you are, what's going on with you. If I can help you, I'll show you what that looks like. If it's not something that I can work with, or if I think one of the other providers would be a better fit, I'll put you in touch with her. But do not suffer alone, even if you just want to talk to somebody, just want to be heard. Reach out to one of us. We are here. This is what we do. This is a labor of love for us to help you, to help all the women going through this time, because we don't want anybody to be alone. That said, thank you so much, Terri Lynn, for joining us today. Thank you all for watching the Menowave Lounge. If you enjoyed our chat and you want some more insightful conversations, about menopause or joint health, pelvic floor health, or emotional health, be sure to subscribe on Spotify, Apple Podcasts, or YouTube. And don't forget to follow us on Facebook for extra tips and updates. Our Facebook page is the Menowave Lounge. And until next time, keep tuning in and keep those cool conversations going. Thank you so much. Goodbye.
Goodbye.
All right. Thank you for joining us in the Menowave Lounge. If you'd like to connect with Marti, Robin, our guests, or any of our expert Menowave care providers for personalized advice and support, head on over to our website at menowave.org and fill out an assessment that will match you with a provider who knows just how to help. Remember, you don't have to face menopause alone. Our team is here to provide the guidance and care you deserve. So, take that step towards reclaiming your well-being and connect with a Menowave care provider today. Thank you again for tuning in, and we'll catch you on the next episode of the Menowave Lounge, Hot Flashes and Cool Conversations.